Hey guys, it's Dr. Justin Marchegiani here. Let's dive in. We'll do a quick Q&A session here today. How y'all doing? What is going on? Let's dive in. All right, off the bat, a couple of things. Elizabeth writes in, Dr. J, I have white flecks on a few of my fingernails. Is this a sign of deficiency? Potentially zinc or protein issues. Don't worry about it. When you're in flux of doing gut stuff, it's going to take months to have your gut kind of recalibrate and to have absorption get better. So don't even worry about it. Same thing with finger pads. All that's going to be protein, fat, and or mineral based. Ann writes in, my gallbladder was removed in 1998. I was on PPI until 2017. Which was 19 years ago. I started taking HCl and digestive enzymes last month. I added bile salts. Great. That's smart. That's exactly what you should be doing. Joe writes in, having Hashimoto's is the cold intolerance from blood flowing being directed to organs only for survival reasons. Well, it's hard to say. I mean, number one, if you don't have enough thyroid hormone controls metabolism, right? So metabolism is the sum of all chemical reactions in the body. Part of the result of metabolism is energy, is heat. So if we have low metabolic rate, we're going to have low temperature because of it. But of course, if we're stressed as well, that can definitely intensify it because that's going to drive more of the blood flow to the arms and the feet. So I would say that the stress would actually potentially actually increase the temperature to the hands and the feet because you have better blood flow there and going away from the organs. Very possible. Ann writes in, I have diarrhea twice since taking the bile salts. Can bile salts cause this? Potentially. Make sure you take it with food. Make sure you're taking in fat as well. Is there a place or avenue to get help with tests that need to be run on a financial basis? It depends. I mean, I'd say go see a good functional medicine doc. A lot of people, they go see their conventional doc and they just beat their head against the wall because it's like you're trying to get a surgery done by someone who's not a surgeon. You're trying to get functional medicine, nutritional support done by someone that's not nutrition, right? So that's the problem. You have this kind of vicious cycle that happens. Lisa writes in, do any of the GI clearing herbs interact negatively with any herbal teas like chamomile? I don't know what you mean by that. I mean, chamomile is going to be more relaxing, right? So could the clearing herbs have some die off to it because you're killing stuff? Yeah, it's very possible. Yeah, it's very possible that is the case. What does that mean? It just means that you're killing a whole bunch of stuff off. Is that a side effect with the tea? I don't think so. Okay, let me keep on rolling here, guys. Okay. All right, good. Here we go. Hold on, getting this up here. Okay, good. I've had diarrhea twice since taking bile salts. Yep, we answered that question. Giordano writes in, my daughter's been on vitamin D for months and her levels have gone up from 19 to 28. She's only on magnesium and krill oil daily, is adding K2, switching to cod liver oil enough to help absorption. Hard to say. Number one, the gut has to be looked at. Number two, you didn't give me any information regarding how much vitamin D you're taking. So I'm missing a lot of info there. Robert writes in, I've got IBS. My colon is trying to detach. My rectum is pulling my anus upwards towards my belly button. Any ideas of what could be causing this? Also have liver cirrhosis and gallstones. So again, anytime you have excessive inflammation, everything goes out of control, right? So inflammation, millions of different potential side effects. So you got to get the inflammation under control first. Got to go through the 6 R's. What that could be, digestion, inflammation in the food, lots of infections, all that has to be looked at. Very tough to answer it directly, but inflammation, go to the 6 R's. Sarah writes in, what are the long-term health effects of black mold exposure? And obviously, anytime you have mold or a big like environmental toxin, it's going to stress everything in your body, neurologically, gut, energy, fatigue, thyroid, so everything. Liz writes in, if I'm on a low iron but eat mostly seafood with a few servings of red meat throughout the week, should I be taking an iron supplement? Maybe. Maybe, but if you're doing enough red meat, we'll just have to test you. I'd have to look at your history, Liz, but if you have a history of low iron, continue taking the iron supplementation until we confirm that your levels are good. And in general, just make sure you're consuming a couple bits of red meat a week for sure. If you want to add a little bit of liver in, that's great. If you want to add some liver in, especially during menses, that's even better. Is there any harm or benefit to women taking prenatal vitamins long before wanting to have a baby? I've been thinking about this. Not necessarily. I mean, I've compared like my multi-support pack to any prenatal that's out there. The big thing is you'll see some extra iron in that product. You'll see sometimes some extra calcium. Like the amount of folate or B12 that's in mine is the same as a prenatal. It just depends because some women may not need extra iron, some may. So we kind of have a general multi that can work across the board for all sexes. And then we kind of stack on there other things if needed. So it just works out better that way. But in general, I wouldn't worry about it at all. Amelia writes in, Dr. J, is there anything I can do to help with the pollen count in my area right now? I feel inflamed and puffy. So yeah, I mean, what you could do is you could do some stinging nettle. In my line, we have a product called Allerclear that's got stinging nettle. It's got quercetin in there. It's got some potassium bicarb. That can be really helpful to help kind of help degranulate histamine. You could also do kidney glandular, higher dose kidney glandular, which has a lot of DAO in it, which is an enzyme that breaks down histamine. That's helpful. Is the issue with tomatoes from autoimmune perspective the seeds, or is it the entire tomato? Could be a combination of the seeds and or the solanine content of the nightshades. Barb writes in, my friend has acid reflux a long time. She's on a reflux diet, which seems to help. What's the next step? Is it possible to get the sphincter muscle working? Yeah, you got to go through the 6 R's, right? Remove the bad foods, replace the enzymes and acids, repair the hormones in the gut lining, remove the infections, repopulate gut bacteria, retest. So it's always going to be the 6 R's with those issues specifically. Can I increase my thyroid balance to 4 times a day? I have no information right now about what's happening, about where your levels are at. So we'd have to have a consult, Amelia, and look at your labs to see where you're at. Jen writes in, what are your favorite spices? I like cinnamon. Cinnamon's my favorite personally. I put it on my green apples, and I do a little bit of vanilla in my coffee in the morning. Those are my 2 favorites. Low Heat writes in, where'd it go here? Hey, doc, what do I do if chronic EBV is behind part of my brain location, tinnitus, limb swelling, and neck and pelvis and testicles? It happened on taking immunosuppressants for autoimmune. Number one, don't go there first. I typically go after the gut issues first and do the general 6 R's because a lot of the herbs that we use to knock out gut issues tend to have antiviral benefits, like olive leaf and golden seal and berberine, right? They can have oil of oregano at higher doses. These things can have really good antibacterial benefits. And 80% of the immune system is in the gut. So work on the gut stuff first, work on the hormone stuff first. And then if we see issues or we see markers on tests, we can always add in extra support to go after any latent EBV. But just deal with the gut stuff first. And you're going to also be dealing with the viral stuff as a side benefit, if you will. Is milk kefir okay to consume if my gut is wiped out of beneficial bacteria? Probably not to start, just because there could be a lot of milk sensitivity. You got to be careful with that, but maybe afterwards for sure. A good intermediate, maybe just coconut kefir instead. Is AIP required if you don't notice any food allergies? Is it a protocol to heal the gut? It depends. If patients are relatively healthy, it may not be necessary. If there's some autoimmune stuff or they have some foods in there that could be an issue, it could be just a good starting point to do for a few weeks and then do a reintroduction on those foods and do it methodically so you know what the issue is. Amelia writes in, thoughts on lymphatic massage to help with clearing inflammation? I think it's great. I think it's really good. Liz writes in, thoughts on taking 2 thyroid balance twice a day to help with energy, or should I just stick with 1 twice a day? We need to test your hormones, Liz. Again, thyroid balance has actual thyroid hormones. We need to actually look at your hormones, see where you're at, and then make a decision if we should go up. If TSH is already too low, we don't want to drive it down anymore. So we just got to be careful with that. K Gupta writes in, how do you get 6 servings of greens every day? Well, I mean, big handful, that's like 2 servings right there. So if you just do that at 3 meals, or you do 2 bigger ones at a meal, that's 3 or 4 right there. It's not hard at all. 2 servings per meal or 3 servings. And 3 servings is like that much. I mean, that's 1 serving. So if you have a big side of greens, that could be 2 or 3 one meal. You do that twice a day, you're there. Nick writes in, Dr. J, could you explain briefly where the majority of nutrients are absorbed? I'm thinking the small intestine. Yes, correct. Small intestines where they're absorbed. If so, why would minerals, daily coffee enemas be bad for removing minerals? So that question, it depends, right? It can, because you're wiping out, it's flushing up the colon and it's going to evacuate things that are in there. So if there are minerals, that are in your gut, because like the small intestine kind of like will reabsorb electrolytes in the large intestine. So it's possible you could prematurely flush some of those things out with a coffee enema. So I'm not a coffee enema expert, but I think it'd be better to do it in the morning on an empty stomach. That way it's not disrupting as much of the digestive process, because you've had at least 12 hours or so of nothing being in there. And so it just depends. Because if you're flushing a lot of those things out, that definitely could create some mineral imbalances. So you want to really do an even better job afterwards getting the extra minerals in there. Hope that helps. Hey, Liz, you're totally welcome. Glad that's helping you. Amelia writes in, Aquasan update, whole house filter plus RO. I never realized how chlorinated my water is. Smelled until now. What a game changer. I totally agree. I got a whole house as well. And I have a RO for my countertop, and I add the Redmond's real salt back in. Let me check on my Facebook here. A couple questions on Facebook. Sherry writes in, hey, Sherry, I'm getting bugged about my mammogram. Any alternatives and recommendations? Yes, do thermography. That's going to look more at heat and blood flow. Much better. Second after that would be ultrasound. Great question. What's a good baseline to follow for high blood pressure? Diet first. Yeah, diet first, because high levels of insulin will drive up. It'll cause constriction in the blood vessels, and it'll also cause excess sodium retention, which will increase pressure in the vessels as well. So keep insulin under control. So keep the carbs dialed in. And then the next nutrient on top of that is keeping your blood thin. So the best thing for thinning your blood is going to be fish oil and ginger and keeping inflammation down. And then the next thing after that that can be done would be magnesium. Magnesium is going to be an excellent way, and potassium, but magnesium for sure, to help provide extra minerals to kind of relax your heart so it's not in overdrive and it kind of relaxes the vessels. Great question, Sherry. Christina writes in, hey, Dr. J, what are your thoughts on fluoride in children's toothpaste? Stay away from it. Toothpaste that I use, I have two brands. My favorite is Revitin. It's an orange flavor one. It has tangerine oils, prebiotics. That's the one that I brush my son's teeth with every night, and my own. I go back and forth between Revitin and Xylowhite Cinefresh. Those are my two favorite. Great question. But yeah, I stay away from fluoride. The number one cause of cavities in ages 10 to 14 is actually dental fluorosis. Too much fluoride can actually create cavities. So I stay away from that. Great questions, though. Stephen writes in, do you have a blood range for inactive vitamin D? Not really. So inactive vitamin, so what do you mean by inactive? Do you mean D3 or D2? So D2 is going to be calcitriol. There should be like a 1-to-1 relationship with it on average. So, 50 on the vitamin D3, 50 on the vitamin D2 in general. Liz writes in, do you have any iron supplements in your line that you recommend? Yeah, Iron Supreme is an iron bisglycinate. That's a good iron. It's very well absorbed. Conventional medicine typically uses the ferrous sulfate, which tends to be more constipating. K. Gupta writes in your 6-hour program, which steps are done in parallel? So typically, once the third hour comes in, so the first hour is removing the bad foods, replacing the enzymes. That's kind of done while you're making a lot of the diet changes. The third hour comes in as we add in healing nutrients for the gut lining and starting to deal with the hormones. Why? Because dealing with hormones help with inflammation. Hormone health helps reduce inflammation. Inflammation is one of the biggest driving factors of gut permeability and a weakened immune system. Then we're working on all the hormones while we go to the 4th hour and start dealing with the infections. And then as the 5th hour come in, 5th and 6th hour come in, we may move to adding in extra detoxification support. Dennis Wright said, I heard a chiropractor say that the combination of fat and sugar is potentially more harmful than sugar alone. Why is this? Yeah, that's true. So, I mean, where you're going to get the combination of fat and sugar is going to be typically junk food that's going to have a lot of trans fats while at the same time having a lot of sugar, because insulin opens the gates for sugar to get stored as fat. And if we already have fat there with a whole bunch of sugar, that's going to accelerate fat storing even more because we have more material that can be stored essentially. Didi wrote, hi, doc. Typically, how long does it take to clean for parasites, bacteria overgrowth, and autoimmune bacteria found on GI map? 60 days is a good starting point, but it just depends what kind of parasites. Did you say 4 different parasites? I want to know which ones, but that could take longer. That may take 60 to 90 days and then retest and see where we sit. Excellent. Let's see here. Next question. Stuxnet right in. Hey, Dr. J, I have a stomach problem and the stool test came back. It said Pseudomonas and C. difficile are the culprits besides dysbiosis. What can I do with the Clostridium? So if it's C. diff, We typically use clearing herbs and we use high dose Saccharomyces boulardii to help. But got to address the whole picture. Can you repeat the items to heal the gut again? So with healing the gut, it's the 6 R's: removing the bad foods, replacing the enzymes, repairing the gut lining, and repairing the hormones. Now, repairing the gut lining, we may use nutrients like L-glutamine and DGL and aloe and slippery elm and just healing, soothing nutrients. Ginger is really good as well. 4th R is remove the infections. That's going to be specific. If we have H. pylori or fungus, that may change what's going on. 5th R is going to be repopulation, re-inoculation. Christina writes, any thoughts on laughing gas for kids to cure a cavity? Well, do you mean put them under so they can be anesthetized for the cavity? I'm not sure what you mean by that, but yeah, I mean, that's anesthesia for that. A lot of times cavities can be cured. Go check out my podcast where I interviewed Dr. Stephen Lind. He's the author of The Dental Diet. We talked all about that. What supplements do you suggest for osteoarthritis? It depends. So if you're a menopausal woman, the hormones have to be addressed because hormones are really important for osteoclast and osteoblastic activity to build back the bones. But first, make sure your gut's working well. Of course, extra collagen, bone broth, good minerals. And then we may add in some glucosamine and some additional high quality magnesium, calcium, chelated form. It just depends. You got to get all the absorption and the hormone style then. Excellent. But yeah, in regards to using laughing gas to put someone under, it just depends. If you can withstand not doing it, that's ideal. But if the pain's too much and you don't get a compliant kid, then it may be what you need to do. Okay, excellent. Let's see here. Doc, I have severe stomach problems and the stool test came back. It said Pseudomonas and C. diff. We already addressed that question. Mohit writes in, thanks, Doc, for your suggestions on EBV. I'm doing clean organic keto, some herbs for that. I'm taking neem, ashwagandha, olive leaf, oil of oregano, reishi. Good. Excellent. Amelia writes in, thoughts on front-loading calories, eating less after 3 p.m. I'd like backloading personally. I think backloading's better. What did your last GI map show? Still in the middle of probiotics right now. We'll be doing one soon. I'll keep you posted. Elizabeth writes in, are there any foods that should be avoided to consume to help low thyroid function? I would just say make sure you're not doing an excessive amount of goitrogenic foods, right? Broccoli, that brassica family, that can decrease iodine uptake. So just make sure you're not doing excessive amounts of raw foods of that. But again, doing it cooked is going to be much better too. Excellent. So Bohan writes in, hypothyroidism and low stomach acid, do you see a connection with clients? All the time. And I actually have a blog post on that topic. Maria writes in, hey, Dr. J, what are the causes and symptoms of uric acid? Well, most people think uric acid is going to be higher for people that like eat too much animal products. Typically, the bigger cause is going to be too much fructose. Dr. Johnson out of the University of Colorado has done a lot of research on this. Fructose gets metabolized to uric acid. So people that do a lot of meat, a lot of times it's like rich foods that involve wine and other types of excess carbohydrate things. So my opinion is going to be the fructose that causes the bigger issues, the sugar. Not worried about clean, healthy forms of meat. All right, excellent. I consume more food during my LH phase. What is the reason for that? Just could be the progesterone spiking up. It's probably increasing your appetite a bit. Very much could just be that. I find a lot of women are more blood sugar sensitive in that last phase. So really making sure you consume more magnesium. A lot of women consume a lot of dark chocolate during that phase because magnesium is very rich in dark chocolate. K Gupta writes in, I saw his aloe white toothpaste has carrageenan in it. Is it a big deal or no? I don't think it's a big deal personally. But if not, the Revitin is a good option. Dr. J, can you repeat the name of the iron supplement? Yeah, my line, that's called Iron Supreme. Iron Supreme. What's your protocol to fix cellular hypothyroid? So it just depends, right? Depends what your labs say. Depends what your adrenals labs say, your female hormone labs say, your thyroid labs say, your gut, your diet, your lifestyle, because everything functions in dysfunctions together, right? Nothing just spontaneously goes out of whack in isolation. And I think that's where conventional medicine people are really connected to functional medicine, because everything happens in isolation in medicine and conventional medicine. In functional medicine, everything happens together. So we have to look at the whole picture. Why backloading calories versus front load? Go watch my video on backloading calories. Done lots of studies, people that consume their calories throughout the day, some at the end of the day, it tends to be better. And I'm talking backloading, I'm more backloading on the carb side. Backloading on the carb side, I think people do better if you're going to intermittent fast. Obviously, you're combining the fasting at night and then a 5 to 7 hour, 5 to 8 hour period in the morning. So you're stacking that fasting period. I think people do a lot better doing it that way versus fasting at night and then going into sleep, because sometimes that low blood sugar that happens before night can really cause poor sleep. That's why it's better to do it that way. How long can it take to recover from EBV in brain, ears, neck, limb, testicles using keto and strong herbs? I mentioned. Well, I mean, number one, you have to actually figure out if it's even an EBV issue. I think there's a lot of assumptions that go into that, but do the things that I mentioned above, and we should have significant improvements in 3 to 6 months. You're welcome, Amelia. And Sophia writes in, how to regulate parasympathetic vagus nerve. I mean, first thing to do is breathe through your nose, deep breathing through the nose, have a healthy anti-inflammatory diet, and heavy attitude of gratitude will be one of the first and best things you can do. Obviously, you can do gargling in the morning, gargling stuff, and then you could also just do singing. That's going to activate the vagus nerve number 10 in the back of the throat there, and that is going to stimulate the vagus. Of course, you can do like the M-Wave or meditation, get your Calm or Headspace app going. That's obviously going to help as well. Deep breathing. You can always gargle in the morning for a bit. Like, it's got to be a really intense gargle though. But those are all beneficial things. All right. And then a couple questions here. Welcome, Yvonne. Christina writes in, natural male testosterone enhancer, food or otherwise. Well, I mean, food's going to be anything rich in zinc. So pumpkin seeds are really good. Oysters are phenomenal, very high in zinc. And then male products, testosterone, anything that has tribulus in it, or horny goat weed, or tongkat ali. These are going to be really good. If there's not enough zinc or selenium, that can be a big issue as well. So those would be the first couple of ones that I would recommend off the bat for sure. What's the best diet for a 41-year-old woman to get lean and eliminate stubborn fat? Well, I mean, the first thing I would start with is a keto paleo template for sure. Stock EBV antibodies were way high in IgG and IgM test. What could be the issue? Yeah, so if IgM antibodies are high for EBV, then it's definitely an issue. So I still work with the gut first, but the things I do for EBV are going to be reishi and silver and a whole bunch of those kind of nutrients to help. But work with a good functional medicine doc to help you. Amelia writes in, what's for dinner tonight? Well, tomorrow night, I'm going to a restaurant called Eddie V's. They're great for seafood. So I'll probably have a dozen oysters and some king crab legs, and they got a really good salad. Maybe I have 1 glass of Prosecco, something like that, something low key. Tonight, my wife, we may be doing some cauliflower dairy-free pizza, which will be fun. Gotta like that. Try to keep the carbs down when I indulge. Try to keep the inflammation down when I indulge as well. Awesome question, guys. I got to jump on to patient calls here. I may come back later on today. We'll see. Look for my messages in the feed. Thumbs up, subscribe. Make sure you access my Thyroid Reset Summit. It's going in Encore Week. So if you didn't get it, let me know. I'm going through my final edits of my book. So that'll be out soon, the Thyroid Reset. So keep an eye on that. And we'll be chatting really soon, guys. Have an awesome weekend. And comments below. Want to see them. Take care, guys.